We are live.
Aloha, Charlie. How are you, Charlie?
I'm doing fine, Brother Mel. How are you doing?
I'm doing extremely well as I get my stuff set up. Everybody, welcome to our COVID discussion tonight. It is Saturday, April 18th. And let me get my camera working over here. Okay, that's all fine. Let me get this thing going here.
Well, as Mel is getting that going, yep, today is Saturday the 18th. I'd like to send a shout out to my son whose birthday is today. My youngest one.
Wow.
Yeah, it's his birthday.
How old is your youngest? How old is your youngest one, Charlie?
My youngest boy is 32. 32 years of age. And so I just like to say aloha to him. And he was also my best man when Stephanie and I got married.
Wow.
So yeah, so
well, happy birthday. Happy birthday, happy birthday.
Name is Adrian. Adrian.
Not sure if he's watching, but if he is, happy birthday, Adrian.
Yo, Adrian.
All right, well, Charlie, we got a heck of a show tonight. We have Minnie Ko. She is a consultant out there in South Korea. She's in Incheon right now. She was a former executive director for the economic development on Oahu under Mayor Caldwell, and she now resides in Korea and gets to Oahu quite a bit. But she has been there from the beginning of the crisis, the COVID crisis. She has been instrumental working with the South Korean government, and she'll talk about that tonight. But before we get started, I just wanted to, again, remind everybody these shirts are available. Charles, you want to model that shirt real quick?
Yes.
See, and if you look right here, it says COVID-19 2020. So it's a commemorative. We're making this shirt available for anyone that wants. It's $10. All the money will go to charity. Again, we sold 5 shirts last night. All you got to do is email me or message me your sizes, PayPal, melraposo@gmail.com. Just shoot me a private message and then I'll respond with how to pay. We don't keep a penny. The shirts have been donated by Kirk Correa, his t-shirt shop, his t-shirt business. He's donating everything, the shirts, the design, the printing, and he's not taking a penny, but all of the proceeds will go to a charity that Charlie and I will pick. One that will benefit the island of Kauai, and we're actually working with a few agencies right now to see how we can make it happen. So again, it's an awesome shirt, really, not because my name and Charlie's name is on it, but it's a commemorative t-shirt for this crisis that we're all going through. Kind of like the I Survived Hurricane Iniki. This one is unique. You'll never get it anywhere else. There is no one on the planet that will print a shirt with Charlie and Mel's picture on it. So this is one of a kind. And thank you, Kirk, for allowing us to do this. So thank you very much. Now, the other thing, as we do every night, hit that little share button. Hit the little share button. Start a watch party. Do whatever you need to do, because tonight's information is going to be critical. We're hoping that this information gets to decision makers. It already has. Ms. Ko has already sent several pieces of correspondence to Oahu, but we're hoping that this will be informative and beneficial. Everyone is trying to do their best to get this thing done. But again, Charlie, we learned long ago, you don't have to reinvent the wheel.
Yep.
Find something that works and copy. And that's what I'm hoping. The objective tonight is to get this message heard by
Mel, I tell you, it can get out there with the viewers that we have tonight. Right now we've got about 95 of you that is watching, and if you hit that share button, it will get out to more of your friends. And then if we can get a mass of people after tonight, and if you're convinced that she speaks with authority, then I would bet you that some calls can be made to either legislators or the county council or the different councils on each of the island to say, hey, take a look, because you'll be uploading this entire event tonight, right? Right, Mel? On YouTube?
Oh yeah, it'll be on YouTube later on tonight. But
Yep.
for right now, hit the share button. Hit it, please. Everybody share it. If we got 101 people, if we share it now, it'll go out and it grows. And we want to get this out to as many people as possible. And
Yep.
the numbers will grow. We'll get to 300, 400 tonight, but we want this thing to reach thousands. So has the state lifted sunbathing in public parks and beaches? No, they have not. The state has just closed all the beaches. They've closed it all. You can still swim and surf and exercise in the water, but the beaches are off limits. And that was done yesterday by Governor Ige. So anyway, awesome. Thank you guys again for joining us. We're gonna bring in Minnie because we wanna spend as much time with her, and we'll definitely share your questions with her. But we're gonna bring her in and get this party started. So again, before she okay, she's here. Go ahead and share the button, please. If you haven't clicked share, share it now, and let's get this thing viral so the right people, the right decision makers can hear what Ms. Ko. Minnie, I already introduced you a little bit. Welcome to the live. Can you hear me?
Hi, Mel. I can hear you.
Awesome. Hey, Minnie, thank you so much. I believe nothing happens by accident. Not long ago, I was asked to join Council Chair Ikaika Anderson on a sister city trip to South Korea. Your mom, Mrs. Ko, was the most awesome host, mentor, translator, whatever. And then we got to meet your family as well. So thank you for being with us tonight, man. I really, really, really appreciate it. And I think the people will really enjoy hearing what you've got to say.
Thank you for having me.
So you've already met Charlie, Iona. Obviously, I'm Mel. And what we're going to do, Minnie, is I'm going to turn this thing over to you. I'm going to switch the camera. It'll be just you. If you can just talk a little bit about yourself. Give us a quick introduction. And then just tell us what's going on in South Korea. How did this all start in South Korea? And what you folks have done to keep the numbers at a very low number and very successful programs. And then as I sent you a message about now the South Korean doctors and scientists are looking at the possible reinfections or the resurgence of this disease. So with that, Minnie, I'm going to change this real quick and you can take it away.
Okay, thanks, Mel. So just to briefly introduce myself, I just want to keep it brief. My name is Minnie Ko. I used to be the director for the Office of Economic Development for the city and county of Honolulu. And now I'm here based in Korea. I go back and forth between Korea and Hawaii. I have a consulting marketing company both in Hawaii and Korea, so that has me traveling back and forth. But to get to the more important issue, COVID-19, and it's what they've been doing here in Korea, I just wanted to start with a brief overview and timeline of COVID here in Korea, starting with today. So as of today, the number of current confirmed cases in Korea is at 10,661. And of those cases, 8,042 have been are considered recovered. They changed the term from recovered to released from quarantine. So over 8,000 people have been released from quarantine. And of those 10,661, 2,385 people remain in quarantine and 234 people have deceased. As of today's numbers are looking really positive. There have only been 8 positive cases confirmed today, and yesterday it was at 18. And so, this is a huge difference from what we had seen. And taking you back to the first case in South Korea, it was on January 20th. So it was from a woman that had traveled to Wuhan in China and came back to Korea on the 20th. And she was Korea's first case. From January 20th to February 17th, there was a really slow rise. And by February 17th, there were 30 people who were confirmed positive. Now, case number, we call her patient number 31. Patient number 31 made all the difference in Korea. And she was the person that was part of a religious sect cult here in Korea. And before she was positive, she had attended a church gathering where they had a service with hundreds of people. And it was through her, she's considered the super spreader here in Korea. It was through patient number 31 that just hundreds of people had contracted the infection, and it spiraled out of control, where by February 29th, in one day, the peak here in South Korea was at 909 new cases and that was on February 29th. And so in going from 1, 2, 3 cases a day, on the 29th of February, there were 909 new cases. And that upward trend continued, where we would see positive cases in the hundreds every day. And then I believe it was a few weeks after is when Korea really started to flatten the curve. And, I think it's really important that, we take a look at South Korea and what they've done, because, they've completely flattened the curve, and now the virus here is really it's contained, and you no longer have people in a panic. And they did this while never locking the country down. So the country was never shut down, the country was never on lockdown, people were free to travel, everyone was still working. And people have looked to South Korea to see, okay, how did they do this? And really, it's due to a few different reasons. But first, it was the immediate response to that patient number 1. So that first case in Korea, there was an immediate response. Once that one person had been infected by COVID-19, what happened was the central government, it put all of the metropolitan cities, the provinces on high alert. And so all of these cities and provinces, what they were required to do was create the proper testing facilities, to have the proper staff in place, so that should a case occur in their city, that they're able to do the contact tracing, do the testing that was needed. So it was that immediate response to that first patient. And then, as everyone knows, the aggressive testing, tracking, tracing that's done here in South Korea. And, it's throughout this entire process, the government has been so transparent. They've been completely transparent with everyone here, where, information on the patients without providing private information has been shared with the public. So everyone knows when there is a new case, they know exactly where that new case is. And you also are shared the information of, that person's whereabouts. And so where that person had traveled to a few days prior to contacting the virus. And here in Korea, which, I think this is the problem back at home in the US, is really, it's more of a national effort. Everyone is working in this together. The cities aren't doing their own things, the provinces aren't doing their own things. It's a collective effort, run by the central government. And so, I do think that it's due to so many different factors that South Korea has been able to contain the virus. But, with all of this said, they're still on high alert, because last week was Easter, and just a few days ago, they had their general elections. And so for the next 14 days, for the next 2 weeks, all of the city governments, all of the provinces, they're on high alert, just making sure that there aren't any new cases.
Thank you very much. Thank you. Interesting numbers, scary numbers, and you get up to the 909 cases, new cases in one day. a lot of that because of patient number 31, one person. And that's what we've been trying to say, that there's a lot of people that feel, and I just saw it today, some comments on Facebook, they want to open everything up here in Hawaii, or at least on Kauai on May 1st. The difference here is we do not have the mechanisms in place like South Korea. We are locked down, we are shut down, but we still allow people movement. We still allow travelers to come in from the mainland. Yes, we have a mandatory quarantine, but not everyone follows it. People are getting in contact with people. And I think that is the frustration. And I'll be talking a little bit in a little while for all of those of you that wish and hoped and prayed that we could open up by May 1st. Well, you're going to get your wish, and I'm going to share that in a little bit. And I don't think you're going to be happy with it, but it is what it is. Can you, Minnie, take us I read your literature that you sent me, and we talked about it a few nights ago here. What happens when someone gets tested positive? What happens?
So here, once a person, let me take you back a little. So of these 10,000 cases, 10,000 plus cases, over 99% of the cases, the government knows exactly who the origin was, who that source was. So over 10,500 of these cases, you know exactly how they had contacted the virus. And it all goes back to what happens when a person is positive. So here, if let's say I'm positive and the lab sends the results back, whether it's at 2 or 3 in the morning, and I'm positive, the city is going to remove you from your home immediately. And so the city sends out a team. It doesn't matter if it's 1 in the morning, 2 in the morning, 3 in the morning, they're at your house and they're ready to remove you. So they come in fully dressed in their PPE, and that person is removed from their home. Simultaneously, what's going on is an investigator is working with them, asking them questions about their whereabouts the past few days leading up to them being positive. And they take all of this information down, and then they have a contact tracer contact all of those direct contacts. And once morning comes around, those contacts are immediately required to go in for testing. And so all of those direct contacts go in for testing. And then simultaneously, again, what's going on is a disinfection team is sent out. And so it doesn't matter if it's at 2, 3 in the morning, the city sends out a disinfection team to the residents, to the surrounding areas, to anywhere that that person had been the past few days. And they disinfect the entire area, the home, and they make sure that the infected person does not remain at home, because they'll have the possibility of infecting their family members or whoever is in that household. And so, I can't stress enough how important it is that once you're positive, you need to be isolated. You need to be removed from your home. And here in Korea, beginning with that first patient, the first thing that they had done was create these quarantine isolation facilities. And what they do is they look at your case and they look whether your symptoms are mild, moderate, severe. If you have mild and moderate symptoms, what they'll do is they'll send you to a facility. Usually it's a hotel in the city that's not being used, that has been reserved for these purposes, and they're put in the hotel room where they can completely isolate themselves. A person comes in to monitor them. Their temperature is taken twice a day, and should their symptoms become worse, then they're immediately taken to the hospital. But they are never left at home to self-medicate and take care of themselves.
Minnie, this is Charlie. So you're saying that from day one, once the investigation starts, it's about 99% of the time, they already know who the target is and who they came in contact with. So given this knowledge that you have being over there and having been with the city and county of Honolulu, which pretty much is similar to the rest of the counties in the state. One, as an island, we're isolated, right? We have an isolated zone. But you said that they don't leave the discretion on isolation to the patient. They will call the shops, and that way that patient, there is no way that patient can come in contact with anybody, correct?
Yes.
Okay, so given that, and I'm pretty sure you've been monitoring what's been happening here in the islands. At this point, you know, they want to, I guess because of the way the economy is right now, and they want to fast track and open up business. I personally, and I'm not the expert, but you know, you're probably more of an expert because you've gone through it with, you know, with Korea. What do you see if they do open up? Are we running a risk? Is it in your opinion? I mean, what do you think? And I don't want you to feel that, you know, it's the absolute, but just from, you know, if you were somebody looking into our situation, what do you think if we open up now? Because I have some fears, because I don't think everything is contained, because we don't have enough testing like you folks. And so and we don't have testing facilities like how you set it up. And I don't think we even have fast track teams to immediately move out and work on it 24/7. It's like when it comes, but everything is based on what the test results show. And sometimes it takes some time to come back. So in the meantime, the infection is filtering, you know, it's filtering out. It's moving. Instead of having it contained, the swath pattern now gets bigger and bigger and bigger. So it's harder to contain. So I just wanted your take on reopening back the state.
So Charlie, this is just my opinion on based on what I've seen here and what I've been following back at home. Right now, Hawaii, as a state, all of our counties do not have the system in place that it would just, there are so many fears and so many things that would probably go wrong by opening on May 1st. Should the state want to open on May 1st, I think that they need to have a system in place. You know, they have to be ready to be completely transparent with the public. You know, they have to have testing facilities. They have to have the contact tracing programs. They have to have the ability to remove someone that is positive from the rest of society there. You know, it's just, I don't feel confident that Hawaii has that in place right now. And like you saw in Korea, it takes one person for thousands of people to be infected.
Okay.
Well, and I think I think a lot of us share that fear that we don't have. Number one, I mean, we've heard it straight from the Department of Health that the director that, you know, the contact testing is unmanageable here. We don't even have that in place. We don't have, I believe we do have the capability, but we don't allow the testing. You know, one of our doctors are saying, and in fact, our Dr. Miskovich is going to be on Monday, but you know, he's saying there is no shortage of tests, and that in fact we should be widespread testing. Every expert in the country is saying you cannot open up your state until you have widespread testing. That doesn't exist here. We have very limited testing, which is a very strong concern for me. And we will continuously have incoming passengers coming in from the mainland, coming into our state, to come in and self-quarantine in their hotel room, which we know doesn't happen. They're in contact with the crew. They're in contact with the people at the rental car. They're in contact, and the state is not willing to implement a system like South Korea, even though they know that it works and it's proven. And that's a huge, huge frustration.
Mel, maybe I could briefly share with you what happened at the airport here. And so, like, South Korea has never locked down its airports. Everyone is free to come into the country. But, where they're at right now is because there's so many imported cases into South Korea. And of the cases just this week alone that are positive cases, over 50% are imported. They're brought in from abroad. What they're doing here is once you arrive at the airport, whether you are a foreigner or a resident of Korea, they check your symptoms. And should you have any of the COVID symptoms, then you're immediately taken to a quarantine room where you need to wait to be tested. And then you're put in a hotel room close to the airport where you need to wait a day until your test results are out. And even then, should your test results be negative, you are still required to self-quarantine for those 14 days. The people that aren't showing symptoms at the airport is no one is allowed to go on their own. The cities will shuttle them over to a testing facility. So let's take Incheon. You arrive and you are trying to get to a hotel in Songdo or your home in Songdo. The city sends out a shuttle, and that shuttle takes you directly to a testing facility. You don't get to go to your hotel. You don't go home first. You go straight to the testing facility. You're tested. Usually the test results here in Korea come back within 6 hours. And so you'll know within 6 hours whether you're positive or not. As soon as they're tested, they're taken by the city government to their residence or their hotel. And again, they're required to be under 14 days of quarantine. They're checking on you 2 times a day. They have people randomly going out to see if you're actually there. And if you're not, and you break the quarantine law, then it's a $10,000 fine with up to 1 year in jail.
That's nice. Again, that doesn't happen here. And that, I think you need to have that infrastructure in place and all of it in place before you start to open up. So you folks had that in place, and that's why you didn't have to worry about your borders, because as people came in, the system was in place already. What happens if someone refuses? What if someone tells your Korean government official, hey, I'm not going with you? No, what happens?
They'll be
so
sent
they
back.
to the north and they get shot?
People that refused to be tested and they were sent back to where they came from. They immediately send them back.
I mean, over here, we get people protesting at the county building this morning because they don't want to wear a mask and believe they should be able to do what they want. And America is landed free. And we take that to an extreme, even an emergency declaration. So I can only imagine what will happen is if someone comes off that plane and says, no, we don't even have the facilities. And I think, and there's no, as far as I can tell, there's no movement to that type of infrastructure. I mean, the community, myself, Charlie, I've been screaming for this isolation facility. We have so many hotels that have shut down that actually could be reactivated, brought their employees back to work and run exactly like that. Get them straight from the plane to the facility, 14 days, you ain't leaving your room. Number one, it'll deter a lot of people from coming here. Number two, the ones that come are gonna be protecting themselves as well as the residents of Kauai. So, I don't envision that happening, and it's frustrating. I've read all your literature that you sent across to the governments in Hawaii, but no one's looking at that. They talk about it. I think I've heard it twice on a governor's press conference, but I honestly think they are rushing to open up the economy and just praying that this virus goes away by itself, which we know it won't.
Mel, one of my major concerns, and I've shared this with you as well, is, it's, yes, I completely agree. It's right now, it's too fast to open up, but also the number and the way that we consider people recovered. And so, I was very surprised to find out back at home, you are considered recovered if you no longer have the symptoms, you no longer have the fever or the cough for 3 days, 72 hours. And what surprised me even more was, they weren't being retested to see that, that virus was out of their system, out of their bodies. And here, Korea, they quickly found out that even though you don't have symptoms, that virus remains in your body days and weeks after. And so here, no one is let out of those quarantine facilities until they test negative 2 times within 48 hours. So that once your symptoms have completely gone away, they will test you, and then they will test you again another 24 hours later to make sure that you are virus free before they let you out into the public. But at home, since you aren't being retested, it's really yourself kind of deciding, okay, I think that, I no longer have this virus, so I no longer have to be in isolation, which is, it's frightening.
Now, let me ask you, Minnie, somebody asked this, and Mel and I have continually kind of like screamed this out, but they use HIPAA on us one time. So when someone is found to be positive in Korea, is there anything given to the general public to let them know where that person has been without giving out names, but just say, okay, the person was at this shopping mall? Because we're saying that if they're having a hard time to do contact tracing, at least arm us with something so we can actually police ourselves and say, hey, in Honolulu, if you were at Liki Liki Drive-In, for instance, and I can say, yeah, I was there too, and the person said through the investigation that they were there between a specific time. We may not know each other, so that person, the infected person, wouldn't know what name to give to the health department, but yet we would know that we're there. Does Korea allow that kind of information to go out so everybody knows the person was in a particular area?
I've shared this with our government leaders and the decision makers because I think that it's so important. And this goes back to the whole point of being completely transparent and transparency. But here, once a person tests positive, their name is not given out. But which area, district they live in, which year they were born, and then it goes back and it shares with you up to 2 to 3 days of where this person has been leading up to them testing positive. And this information is shared via social media. It's on all of the city government websites. It's on all of the district government websites. It's anytime a person is confirmed in a certain district, we get these emergency alerts. There are these emergency text messages that come to your phone and your phone starts beeping like crazy. And then you look at it and it says, 12th person has been confirmed positive in this district. And we will give you more information within a few hours. And then within a few hours on all of their social media sites, as well as their website, they share with the community each place this person has gone to, where they work. They share with them the area which they live. And, they encourage people, if you were at this certain place during this time, and you feel as though you have symptoms, please come in immediately to be tested.
Wow.
Yeah, but I mean, if you want the results that Korea is getting, then you got to do what Korea is doing. There is no HIPAA violation. There is no health information violation by letting everyone know where it was. I mean, the way it works here is every day at 12 noon, they send out a report and they say, yep, okay, we had 21 cases new today, 5 on the Big Island, 6 on here, and that's it. And even when someone passes away, they only come out and say, we had our 9th death today. It was a person over 65 years old. That's it. And no one knows. No one knows. And it frustrates me because so many cases, and number one, we don't test enough. So obviously Our numbers are very small because we're not testing, and we're not. I don't believe we're doing the contact testing that we should be doing. Obviously, you get these guys. You don't have control over them because once they test positive, they're on their way. They go home, unless God forbid they're sick, then they go to the hospital. But otherwise, they just go home and they self-quarantine for 14 days. And on the 14th day or on the 15th day, they do what they do. They go right back out. No tests, no consultation, no certification from anyone, which leads me to my next question. Minnie, I don't know if you have the information on this, but Korea is starting to see some of these viruses attacking victims that have already had it once. And that is quite frightening.
So as of yesterday, there are 160, I believe 161 cases in people where the virus kind of reactivated. And it took an average of 13.5 days to as long as 30 days for the virus to come back. And they don't think that it was through another source, through another origin. So they don't believe that they re-contracted the virus. They think that, you know, it was the virus was somewhere undetectable in their bodies, and, you know, it just their immune systems was weak to a point where the virus was able to reactivate. And so of these 160 somewhat people, these are people, you know, that were tested negative 2 times before they were released from the hospital. But, you know, it's 13 days later, 15 days later, 20 days later, they had tested positive again. What's interesting, though, about these 160 cases is that there have been no secondary infections from those cases. And so, you know, they're trying to figure out, is the virus at, you know, is it just too weak to be spreading? You know, they haven't figured out that portion of it yet, but of them, there have been no secondary cases from the reinfected people.
Now, you know, in speaking with that here, we've had situations where first test comes out negative, but then it pops up. So I guess what you're saying is that they're not questioning the test procedure, because here they like to test. They're saying that the test procedure might have been invalid to begin with or inconclusive, and so they go retest again. But, you know, when Mel and I, we discussed this, you know, we've always said that, you know, if there's a mutation happening with this virus, is it becoming stronger or weaker? And does it go dormant and then it finds a specific period where it reactivates? Is that what the Korean government is seeing with this virus?
So in the ones that are that they have the reoccurring viruses, they're finding that, you know, it's dormant in their body somewhere, and it's just not not being detected. But this is after the virus after they've already recovered from the virus. In terms of that, for people testing negative and then testing positive, here we see that, but we see it because there's an incubation period of 14 days. And so there are a lot of tests. There's a lot of testing being done. And if I'm a direct contact, if let's say my sister's positive, and, you know, I had met with my sister leading up to her being positive, what happens is on the day that they find out she's positive, I'm tested. And it's likely that my test is going to come back negative. So what they do is for 14 days, they have me self-isolate. And should no symptoms occur in those 14 days, then on the 14th day, I'm tested again before I'm considered, I'm okay to not self-isolate. I can come out. And, you know, they found through that 14-day period that, you know, there are people that are showing or that are testing positive on the 14th day. There are people testing positive on the 7th day. So you really don't know. You could, if it's in your body and it's incubating, then you're not going to test positive. But once the virus starts to spread and it's active in your body, then that's when it tests positive. So, that 14-day period it's critical, and it's critical that you monitor yourself and you do self-isolate for 14 days.
Is the testing free in Korea, or the cost is shared by the patient themselves?
So if you're not a direct contact and you feel as though you have symptoms, or if you want to be tested, then you are paying a portion, but it's just a really small portion. But if you're a direct contact and you're required to be tested, then yes, it's free.
Okay.
What is the cost of a Korean COVID test? I'm hearing over here. In fact, I was told that if it's an insurance case, it's $200 a test. If you pay cash, it's $100 a test. Do you have any idea what it costs in South Korea?
Is this the cost that the patient is burdening, or is it the cost that the government is paying?
Either. I mean, the cost. Yeah. Let's just say the government is paying.
So the government pays anywhere between to purchase the actual test. It's anywhere between $20 to $25 per test. But a lot of the times, the people in Korea aren't required to pay for those tests, and so those tests are being administered for free.
You heard that, Mel? $20 to $25 per test.
Yeah, I heard that. Yeah, I heard that, and it's 10 times more here, and I think that's part of the problem. But as far as if you're do you need to have symptoms? If let's say I may have been in somewhere that I got my little beep on the phone saying, hey, we have a positive, we had a brand new positive, and he came from this province or this district, and he works at this food place. Now I went to the food place. If can I get tested even if I don't have any symptoms?
Yes.
I don't need a doctor's paper and go through a checklist of fever and chills and everything else?
No, because there are so many asymptomatic people out there, and you can go through the entire virus without having a single symptom.
Someone paid $258. Someone is posting a comment. I know you probably can't see the comments, but someone just posted that they paid $258 without insurance. They took $258 from them. I think that's the frustration too. We don't test enough, and I have, in the last couple of days, I've probably had half a dozen people message me that they went to the clinic, they saw a doctor, they had the symptoms, they tested them for the flu, tested negative, and sent them home with antibiotics. They didn't even bother to give them a COVID test. So that's why I'm concerned, and I think we have a lot more numbers that is not showing here in Hawaii, because statewide they're very critical and strict on who gets a test. And that helps no one. I mean, it helps the state look really good because the numbers are so low, but it's not giving a true picture. We have a lot of asymptomatic people running around right now that's carrying that virus. And I mean, I gotta believe that's true. I mean,
I feel as though our government back at home, our state government, they have to take this more seriously. Here they're even testing the deceased here. And so if you die, and you die because with pneumonia-like symptoms, they will go back and they will test you. And should you have had COVID, what happens is then they go again and they do the contact tracing, where they find anyone that has come into contact with the deceased person a few days prior. But it's really, there needs to be aggressive testing. And I agree with Charlie, if you're not going to do the contact tracing and you're not going to go and do the tracking, then you need to let people know where these people have been. So, let's say it was a Hawaiian Air flight attendant. You need to let people know. You need to let your flight attendants know. You need to let the company needs to let people know, or the government needs to let people know that, hey, a Hawaiian Air flight attendant who was flying on these flights has been confirmed positive, so that anyone that has come into direct contact with them can go in and get tested.
Now, let me ask you about your strike team that you mentioned earlier. Are you able to tell us how many teams are available to respond? Because it sounds like this is a 24-hour operation. That's one. And you know, we talk about aggressive action, like you said. You know, it's really aggressive where they take you out of the house. And I think that's the price that we all have to pay if we want to make sure we don't spread this thing. Because I think, and as you know, and you said it earlier, our local government is taking a position that, you know, we've got so many rights at stake, and they're worried about everybody else's feelings, and yet they're shutting down the economy, and yet it's just like it's an all-around no-win situation. And so, you know, I kind of look at, hey, let's be aggressive on one end so we can benefit on the other end. And so, you know, how many strike teams do they have? I mean, and, you know, is it a team of 10 that responds that you know of, or how does it work?
So Charlie, just, you know, I don't have those exact numbers for you, but just in Incheon alone yesterday, no, on Friday, I was able to go and visit the Situation Room and take a look at their crisis management center. And it's an entire room comparable to a large ballroom at one of our hotels. And you have people seated there everywhere. And these people are the people that are working 24/7 on rotation. And they're doing the contact tracing, you know, they're collecting the data. And the disinfection team is separate. So the disinfection team, they outsource to a private agency. And when they're not available, then the city will go out themselves. But these private agencies, what happens is, you know, the city will contact them to let them know, okay, we need a team sent out to this area and it needs to be disinfected. And so that place will be shut down, completely disinfected, and then back up and ready to operate. Once a person is positive and, you know, they were in such and such commercial building, or they were at, God forbid, a hospital, it's completely shut down and disinfected for an entire day before it reopens. And, you know, it's not likely that a person can contract the virus because it's a respiratory infection through touch. It's usually you need to be in close proximity with a person, but, you know, they have found that the virus lives on surfaces for, you know, anywhere from 24 to 72 hours, depending on what type of surface it is. And so they don't want to take those chances. And so they'll go and if it's a residence, if it's an apartment, the disinfection team will go to each floor and disinfect all of the elevator buttons, the stairwells, just any public area that, you know, that person could have been to make sure that that virus isn't living on any surface.
Wow. Thank you.
A little bit different than how they do it here in Hawaii, and I'm sure across the country. Someone posted that if you're a healthcare worker, you get a discount. It's $130 for a test. They'll make you pay $130. If you're a healthcare worker, thank you very much. Yeah. Mask. Yeah.
The healthcare worker, first responders, healthcare workers, it's completely free.
Oh, well. Welcome to paradise here. What about masks in South Korea? Is that something that's all over the place now, everyone wearing masks? Although in South Korea, it's not uncommon for people to wear masks. I mean, for all the times I've been to South Korea, it was not uncommon to see people wearing masks all around.
So there are several different reasons why people wear masks in Korea. So prior to COVID, if you're sick, then it's, you know, to the courtesy of others so that you don't get others sick, people will wear a mask in public. If it's flu season, people like to wear masks. And then the other is, we have a lot of fine dust here. Yellow dust, fine dust. In the springtime, there's a lot of the yellow sand flying over from China. And so it's really common for people here to be wearing the face mask. So when COVID had the coronavirus, it started here in Korea, everyone was encouraged to wear a mask. And, it's so different from back at home because the type of mask that people have access to it's called KF94, which is equivalent to our N95. And the government, they will pass it out. You can go to your local pharmacy, and if you show identification, you can pick it up. Because with this particular virus, it's better. I think the cloth masks are better than anything, but it doesn't keep the virus away from you. With these other masks, it's 95% blockage. So, you're really protecting yourself. And the government has just made it available for everyone. There was a time in Korea a few weeks back where there was a mask shortage and everyone had been scrambling to pick them up. But that was because people started to hoard the masks. And so you had people going to your local pharmacies and trying to buy 40, 50 masks at once. And then there was a regulation put in place where you could only buy several a week. But since then, there hasn't been a mask shortage problem. You can easily find those N95 masks online to purchase. It's readily available here for everyone.
Just a huge difference, yeah. I mean, just a huge difference of how, and I guess I don't understand why. It's not like you guys, the South Koreans, kept this secret. It's not like they didn't share what they were doing. Every single discussion that I've heard, whether it's locally in our press conferences or on the news or watching the national news, everybody gives South Korea a lot of props for doing what they've done, but yet no one wants to do what they do. And that's the scary part. When you look at places like New York and Seattle and Washington and some of these other states that are just, a lot of people are dying. And I think the complacency here in Hawaii, because our numbers are relatively low. I always tell people when they tell me, our numbers are good. Yeah, we're going to lose some people. Yeah, it's unfortunate. We lose people to the flu. And I tell them, go talk to people like Charlie, who lost a brother. Talk to the people that lost their loved ones and their families. It wasn't just the flu. And I think a lot of people, the way this is being reported here in Hawaii, the way the legislature is a little different. They're harping on the administration, but the way the administration paints the picture, the biggest concern I have of what they're saying is that testing does nothing. I mean, Bruce Anderson said it right out of his lips. He said, testing does nothing for us. It's a snapshot in time. You could be negative today and positive tomorrow. What an irresponsible thing to say. But if you're only talking testing, yeah. If you have a system in place where if you are a contact and you tested negative, you go to self-quarantine and you get tested again in 14 days to make sure you're not positive. We don't have that in place. And that is why testing in and of itself, if you're only taking a test for the sake of taking a test, yeah, it does nothing for you. But if the testing is part of a system like South Korea, and you're utilizing the testing as the basis of the decisions to be whether you're going to go to an isolation facility or you're going to be isolated at home or quarantined at home, then it makes all the difference. Because how else do you gauge? How else do you gauge? In Hawaii, you got to have all the check marks, all the check blocks on the form. You got to have the coughing, you got to have the fever, you got to have the hard time breathing. Then you may get a test. And by then it's too late. And if you don't test that positive, it doesn't show up as a positive. So you're on paper, on all the reports, you're looking really good. All of those people that came in contact with what could be our patient number 31 can just wreak havoc in any community. And that is my fear.
Well, you know, Mel, with the reason why testing and, you know, getting it early, finding out early it's so critical and important, is that by the time the virus progresses, we found here in Korea that, like you said, it's too late. So you could have a full blown out pneumonia, or, you know, if it's not monitored, you know, you could come across other complications. And so it's so important to catch it early and help the person with their symptoms as it appears, because there aren't the COVID symptoms aren't the same for everyone, you know, and I think the US is recognizing this as well, is that, you know, my symptoms may be different from yours and yours different from Charlie's. You know, they're not identical. And so you can't say you need to have all of these boxes checked for, you know, them to administer a test. Also here in Korea, they found that health professionals, medical professionals are able to tell within 5 days if this is going to go from mild to severe, or this person is just going to end with mild symptoms. And so that's another reason why they remove them from their homes and they're under this 24-hour surveillance management, because as they're monitoring them, should they see any type of progression of this getting worse, then they're immediately taken to a hospital so that, you know, they can be given the proper attention and medication. And so, you know, I think that Korea's death rate is quite low. It's at 1.7%. You know, and a high number is of people, the elderly, the people that have underlying conditions, and the senior citizens here. But, you know, they, even with the confirmed cases in the elderly, if it's monitored right, if it's managed right, then it's not a death sentence.
Well, you know, Minnie, you know, sharing with what Mel said, my brother, I'll give you an example. I'll give you a timeline. I read his Facebook comments that he announced to the world that he had COVID. And that's on a Sunday. And so New York time, they're about 6 hours ahead, 5, 6 hours ahead of us. I call him on a Sunday and ask him what the hell is going on. And he tells me, any speaking relative, I said, okay, from this point, we're going to talk every day because I want to monitor you on this. He says, yes, brother. Okay. The very next day, Monday, I can't get through to him. So then by early Tuesday morning, I get a call. I finally get through his phone, but his girlfriend has it, his longtime girlfriend. And she says that he was hospitalized Monday night. He was talking now. So by Tuesday, he's no longer talking. He's on a ventilator. By the end of the week, he's gone. So I think, you know, in a recent study, what a lot of the doctors are seeing now with COVID patients is that they have a common denominator, and that is a lot of them are showing signs of needing to be dialyzed, going on dialysis, because for some reason the kidneys are shutting down, and that's what happened to him. And when they said that he was going to be on dialysis, I thought, you know, 3 days a week, 4 hours a day, which is the normal protocol, right? They said, oh no, we're going to do it 24 hours a day. And I went, what? And by the second day, they were already saying that because the viscosity of his blood was so thick, it was gumming up the dialysizing machine, so they had to give him blood thinners. So I believe you when you say that, you know, these doctors can already see the track pattern, that when they start facing these problems, especially when you got to be dialyzed, they already know the person's going on downhill. Because when they removed his breathing tube, the ventilator, he expired within a minute. It was that fast, even though all the signs showed that, you know, he was there. But I kind of want you to do me a favor, if I can ask you. There's many people right now. We got about 295 viewers right now. And for some reason, people, I don't know, and it's kind of getting a lot of our a lot of the locals here throughout the state kind of upset because they're saying that this pandemic is a scam. And you're firsthand, you're giving us raw information. Can you say that it's not a scam, that it's the real deal? I mean, I don't know where they're getting that from, but there's a lot of them, and it's kind of upsetting the local people a lot.
Charlie, no, it's not a scam. It's, it's very real. People of all ages are dying. And if you don't take this seriously, it's going to spread, just like how patient 31 in Korea was able to spread it to thousands of people. It will spread and you will have hundreds and thousands of deaths. And so, no, it's not a scam.
Okay, thank you. Thank you very much. You made my evening.
I read, well, it's just really math. Average infection rate of a COVID positive is probably 2.5 to 3 people. And then you base that on how many average person, how many people do they come in contact with every day. Basically what it said is this COVID virus has the potential of infecting over 10,000 people from one person, like your patient 31. Now that's if everything lines up, but it's not unusual to believe that, or it is. There's a very good possibility that one person. We're seeing it in Maui Memorial, we're seeing it at the Kona McDonald's, and we're going to see both of those clusters grow. I know your government is very concerned about clusters, as they should be. And we should be as well, because the potential of the spread through people that work in the same place, or families that have family gatherings, or church groups. So clusters are a big problem, and we're starting to see them here. That's why I don't understand. How can you say we're starting to flatten the curve when new clusters are popping up? It's pretty obvious that we're not flattening the curve if new clusters are showing up. I know we're getting close to the end of this, but Minnie, what kind of medical treatment, if you know, are they giving the patients in South Korea that are suffering with COVID?
Mel, it's hard for me to answer that question because I'm not a doctor, but there has been other respiratory infections, viruses here in Korea, like there was the SARS epidemic, there was the MERS. And so it's a cocktail of different types of medication, but it depends on the type of patient that you have, is what I'm hearing. It depends on your condition. It depends on whether you have any underlying, other diseases. It really depends on the individual. And so it's hard to say, and I can't answer what type of medication that they're receiving.
They touted. Oh, I'm sorry, Mel.
I just real quick follow up there. I know it's a really, really stupid question, but I'm assuming that Korea has like an American FDA. Is there a lot of problems with getting experimental treatments through, just in general, not so much with COVID, but just in general? Is your FDA like ours, where it takes, a year and a half or 2 years to go through a process to get something approved?
No, right now, so with this pandemic, everyone is on high alert and it's an emergency. So there are emergency approvals being made. Just I want to say about a week and a half ago, there was a plasma treatment that was done. So they took the plasma from a person that had previously been positive, and, they were able to put it into a person that is now positive. And, they showed positive reactions to that type of treatment. And so there are experimental treatments being done here as well.
Okay. The president has been touting the hydroxychloroquine with the zithromycin. Is that something that Korea used, or they haven't been using that? They haven't been too favorable on that, because there's a lot of pros and cons. Some doctors are saying that the malaria drug, it's effective, but it also kills. So they kind of were hesitant on using it. How has South Korea approach that?
So again, I'm not a doctor, and I don't feel as though I'm at I can say with confidence, but from what I've heard, not erythromycin itself, but there are different antibiotics that work similarly to erythromycin that have been used in addition to the hydrochloroquine.
Okay.
So, it is, I've been hearing that it's being used here and that it works. But it's, I'm not a physician, I'm not a doctor, so it's really hard for me to answer that.
Okay, thank you. Thank you.
Well, thank you, Minnie. It's been an hour, and it's Sunday over there in Korea, right? Isn't it Sunday now?
Yes.
How's our Sunday going to be? Is everything all good? Apparently, the world is still up on, still going on Sunday. So in South Korea, so we got to look forward to at least one more day here in the world. I love South Korea. It's a great country, and Incheon, and just again, we had such a good time. Thank you again for all of that.
Mel, if I could just conclude with,
go ahead, please.
Yeah, if I could conclude with one thing, I just encourage our leaders and our decision makers back at home, more testing, more aggressive contact tracing, tracking, and transparency. You need to be, honest with the public. You need to be completely transparent so that people can prepare for what they're dealing with. And I don't think that it's going to get better until these steps are taken and a system is put in place.
Well, you read my mind, because I was going to ask you before you left if you had one thing to tell the leaders in Hawaii, or if you were governor for a day, what would you do differently? And I appreciate that answer. And I know everyone is thinking that Mel must have coached her. Mel, because it sounds just like Mel. I bet Mel, I didn't coach Minnie. I invited Minnie. She's been in contact with me now for a few weeks, sending me materials that she has been sharing with leaders throughout the state. We had no discussion prior to this other than what the heck was the time difference and making sure that she could get Zoom. And that was it. So we never coach our guests. If you come across as with disagreements with us, so be it. We're just trying to get the information out from different people. You guys have a system that's working. You have a system that's working, that's proven. So I will ask you one final question. If we don't incorporate a system like South Korea, it doesn't have to be exactly like it, but if we don't incorporate a system with the widespread testing, with the isolation facilities, with the immediate notifications on your cell phone, with follow-up information on your all the different government websites and social media, absent all of that, do you think we should be opening up our state to
no, absolutely not. No. That's so scary. No.
I know. I mean, I remember when this all started, Charlie, we talked about it before. When it first started, I thought this was a flu. I thought, man, making such a big thing out of this. And now I'm genuinely afraid of what can happen to our little island. We saw how, Molokai, just a very small situation there, but it impacts the whole community. And, today I got a call, and this is what I talked about earlier. This morning, I'm not a call. I got a message from an airline employee. I'm not going to mention, obviously, which airlines. This guy's, they come to me in complete anonymity to let me know that starting May 1, daily flights are continuing back to Lihue Airport. I contacted our mayor's office. Mayor's office said they weren't aware of it. I contacted our lieutenant governor. He said he wasn't aware of it. I went online. I tried to book a flight on these airlines from in April. Cannot get a direct flight to Lihue in April, because we all know that that's not happening. But you guys go check tonight, May 1st, May 2nd, May 3rd, May 4th, May 5th. I tested it. Alaska Airlines is coming with 2 direct flights from Seattle starting May 1st, and Delta is coming with 1 from LA starting May 1st, every single day. How did that happen? I don't know. Remember last night, Charlie?
Yep.
I said, something is up. They know something we're not, that they're not telling us, because as I watched the press conference yesterday, it was very clear that they were bracing us for the opening of the visitor industry. And while I support opening our economy as quick as possible, absent the types of safety nets that South Korea has, I think it's a big mistake. But if you don't believe me, I mean, no one knows. I checked our mayor's office. I checked our lieutenant governor. I checked American United as well. They don't have flights yet, but check Alaska and check Delta. Don't believe me.
Well, Mel, let me say one thing. And, you know, if I'm going to die, I want to die on my terms. I don't want anybody coming, because we know from day one when this virus arrived on our shores, it was from the outside in, just like Korea. It's from the outside in. It didn't, nobody took a water can and watered it and it sprouted up. It didn't happen that way. So if they're going to open up this island and let people come in, and myself or my grandkids, my children, my wife gets sick, I'd be one pissed off Hawaiian, because if I go and die, I want to die on my own terms. I don't want anybody killing me. That's what I'm saying.
Well, you know, the reason I bring it up, Patsy is upset because I brought it, but I'm upset. You know, when I watched the government, I knew this because when they had the press conference yesterday, the Senate hearing yesterday as well, they focused on how they're going to address the people coming in to the islands. And they spent a lot of time. They had their charts, everything about how this is going to happen. And if you don't have this, you go to this line and that line. And I knew, I had a feeling. And today I'll be honest, the guy that emailed me this, I'm not going to tell you which airlines. He said, Brother Mel, I'm going to quit because I cannot live with the decisions that our corporate office is making. And that's what happened today, this afternoon. So I'm upset. But the reason I brought that up was many of you have been crying, open them up, open them up, open up. I just tell you, be careful what you wish for. People can say this is fear tactics. Call it what you want. I don't care. You know what? If I'm wrong, thank God. But if I'm right, oh boy. Anyway, thanks again, Minnie. I hate to end it on that, but I just wanted to make the people understand that they're not telling us everything. You look at a country like South Korea, totally transparent. They wake your butt up with an alert if someone tests positive. I welcome that. They come to your house and yank you out if you test positive. I welcome that. That's why their numbers are so good. That's why our numbers, we don't even know what they are. But anyway, Minnie, thank you so much.
Minnie, I'd like to say thank you so much. You've really answered a lot of questions unknowingly, but I think because people hear us every night, we needed someone to come on that actually have gone through the trenches, has been a home person here in Hawaii and now home in Korea. You can understand the two. Someone asked me earlier, what's the size? The size is 6 to 1. Korea is about 6 times Hawaii's population base, but yet you all have the ability. You all have this ability to do what you folks do, and I'd just like to say thank you so very much. Appreciate it.
Thank you, Charlie. Thank you for having me on. I enjoyed the time.
Open invitation, Minnie, anytime you want to come on. And, you understand, Minnie, while she lives in Korea, she spends a lot of time here. Her family's here. So she definitely has a very vested interest with us here in Hawaii. And I just appreciate you bringing it on. So tonight, I know we're running a little bit late. Charlie.
Yes.
Minnie, we have a lot of viewers that we started this to pound into people's heads about flattening the curve, staying at home, 6 feet distance, don't touch your face, wash your hands. We're doing that every single night, and it wasn't working. It wasn't working. And then we threatened everybody, said, if we catch you guys violating any of the rules, we're going to yank you, we're going to restrain you, and you're going to be forced to spend the next 24 hours with Charlie and Mel. That didn't work as well. So we decided that what we do every night now, Charles, where's the vamp, Charles? Where's the vamp?
Oh,
every
yes.
night we tell people, and you'd be surprised how many people hang on to this. Look, look at the comments. Time to make the wolves howl. Chee-hoo! So here we go. Start the vamp. Start the vamp. So what we do every night now before we close, Charlie, the vamp. Yeah, that's he forgets this every night. What we do is every night before we shut down, we let the people know you guys ain't gonna flatten the curve, and we are going to flatten the music. Ready, Charlie?
Yeah.
1, 2, 3. Almost sounds like Korean music. It almost sounds like Korean music. Minnie, we love you. Thank you guys, ladies and gentlemen. Tomorrow night, we got Senators Donovan De La Cruz, Donna Mercado Kim, and the amazing, entertaining Senator Kurt Favela, who almost stroked out at the Senate hearing yesterday. They're all three going to be on our show tomorrow night, 7 o'clock. Join us, Minnie. You'll enjoy it. See you guys tomorrow night. Love you guys. God bless. Aloha.
God bless you. Bye.